How does exercise-induced asthma differ from allergic asthma? Have you ever wondered how exercise-induced asthma differs from allergic asthma? Both conditions can make breathing difficult, but they have unique characteristics. Let's break it down. Exercise-induced asthma, also known as exercise-induced bronchoconstriction, is triggered specifically by physical activity. When you exercise, especially in cold, dry, or polluted air, your airways can narrow. This narrowing typically occurs during or shortly after the activity. On the other hand, allergic asthma is caused by exposure to allergens. Common triggers include pollen, dust mites, pet dander, and mold. Now let's talk about symptoms. With exercise-induced asthma, you might experience wheezing, coughing, shortness of breath, and chest tightness during or right after exercising. These symptoms usually improve with rest. Sometimes they can come back hours later, which is known as a late-phase response. In contrast, allergic asthma symptoms can appear anytime after being around allergens. You may notice similar respiratory symptoms, but you might also have sneezing or nasal congestion. Another key difference lies in airway inflammation. Allergic asthma involves significant airway inflammation. This inflammation is caused by immune cells called eosinophils, which can damage the airway lining. This damage leads to increased airway responsiveness and longer-lasting narrowing. In contrast, exercise-induced asthma causes less airway inflammation. The narrowing is mainly due to muscle constriction in the airways rather than inflammation. When it comes to airway responsiveness, allergic asthma shows increased responsiveness after exposure to allergens. This can lead to prolonged symptoms and difficulties in asthma control. However, in exercise-induced asthma, the airway responsiveness does not increase significantly after exercise. The constriction is usually temporary. Who is affected by these conditions? People with allergic asthma often have a history of allergies and may experience other allergic conditions. Exercise-induced asthma is common among individuals with asthma or allergies, but it can also occur in those without chronic asthma. This condition affects both children and adults, including many athletes. Managing these types of asthma also differs. For allergic asthma, management focuses on avoiding allergens and controlling inflammation with medications like inhaled corticosteroids. Rescue inhalers are also used as needed. For exercise-induced asthma, it is helpful to warm up before exercising and use inhalers to prevent airway constriction before physical activity. Choosing sports that cause less airway irritation and avoiding cold, dry air, or high pollution can also help reduce symptoms. In Latino communities in America, awareness of both types of asthma is essential. Many individuals may face barriers like limited access to health care and environmental factors that worsen asthma control. Educating these communities about recognizing symptoms and managing asthma effectively can greatly improve respiratory health and overall quality of life.